Hi, thank you so much for having me here today to talk about the relationship between diabetes, pancreatitis, and pancreatic cancer. I have no conflicts of interest to disclose. Today, I'm going to briefly discuss the epidemiology of pancreatic cancer and then discuss two important risk factors for the development of pancreatic cancer, pancreatitis and diabetes. Pancreatic cancer is the 11th most common cancer diagnosis in the US, with about 60,000 cases of pancreatic cancer diagnosed each year. However, it is one of the most lethal and is the third leading cause of cancer-related deaths in the United States. The 5-year survival for all stages is estimated to be about 10%, and there's a large body of data which shows marked racial disparities in both the incidence and mortality among Blacks and whites with pancreatic cancer. There are a number of risk factors for the development of pancreatic cancer, including genetic causes such as BRCA2 mutation, lifestyle changes such as smoking and alcohol, and two that we will discuss today, diabetes and pancreatitis. We will start with pancreatitis. The diagnosis of acute pancreatitis is based on the presence of at least two of three features, including abdominal pain, increased pancreatic enzymes to 3 times the upper limit of normal, and imaging testing showing characteristic findings. Here we can see a few of those findings, including pancreatic edema and peripancreatic fluid. The diagnosis of chronic pancreatitis is based on the mechanistic definition, which includes pancreatic atrophy, fibrosis, pain syndromes, ductal distortion and strictures, calcifications, pancreatic exocrine and endocrine dysfunction, and dysplasia. Here we can see a few of those findings, which includes intraductal stones, calcifications, and pancreatic atrophy. Pancreatitis is the third most common principal GI diagnosis in the United States in 2014, accounting for almost 300,000 hospital admissions with a total cost of over $10 billion to the US healthcare system. Based on data from the Healthcare Cost and Utilization Project from 2006 to 2014, there has been an increase in the crude number of patients presenting to the emergency department with either acute or chronic pancreatitis. Pancreatitis is considered a disease continuum. Based on data from a 2015 meta-analysis, 79% of people have no further episodes of pancreatitis after their first episode. The pooled prevalence of recurrent acute pancreatitis was around 22%, and among those who develop recurrent acute pancreatitis, 36% will develop chronic pancreatitis. The risk factors for progression to chronic pancreatitis include a history of continuous cigarette smoking and/or alcohol drinking. Meta-analyses have also found that patients with chronic pancreatitis have a higher risk of pancreatic cancer development. In this study, after excluding cancers that occurred in the first 2 years following the diagnosis of chronic pancreatitis, the risk of pancreatic cancer was elevated with an odds ratio of 16. The risk does decline over time after the diagnosis of chronic pancreatitis, but remains elevated when compared to those without chronic pancreatitis. The prior meta-analysis excluded pancreatic cancer cases occurring in at least the first year after diagnosis of chronic pancreatitis, because there is a risk of misdiagnosing a new pancreatic cancer as chronic pancreatitis on the initial presentation. This study from 2014 demonstrated that the risk of a pancreatic cancer diagnosis was most marked in the first year after a chronic pancreatitis diagnosis, with an incidence of 18.04 per 1,000 patient years. While the risk rapidly declined in the second year and became similar to those patients with established chronic pancreatitis in the third year, there is a 5% risk of misdiagnosing a new pancreatic cancer as chronic pancreatitis, and it can delay the diagnosis by up to 2 months in many patients. Next, we are going to discuss diabetes as a risk factor for pancreatic cancer. The relationship between diabetes and pancreatic cancer has been known for over a century. What we know is that the complex relationship between diabetes and pancreatic cancer is bidirectional, meaning that pancreatic cancer causes diabetes, but that diabetes is also a risk factor for developing pancreatic cancer. The relationship between diabetes and pancreatic cancer is of great interest to the National Cancer Institute, who recently published this figure. Some important statistics to know about are that 1 in 100 people with new onset diabetes are diagnosed with pancreatic cancer within 3 years of their diabetes diagnosis, and that 1 in 4 people diagnosed with pancreatic cancer were first diagnosed with diabetes. These statistics are based on findings from numerous epidemiological studies exploring the relationship between diabetes and cancer. There have been 3 meta-analyses as well that have published findings linking diabetes and pancreatic cancer. First, the 1995 meta-analysis reported a 2-fold increased risk of pancreatic cancer in patients with long-standing diabetes and a greater risk in individuals who had diabetes for less than 5 years. The 2005 meta-analysis also found that patients with diabetes had an overall risk of 2 for pancreatic cancer, but this risk was increased in those patients who had diabetes for less than 4 years. It seems like the initial 3-year period after diabetes diagnosis is the most important time point for the development of pancreatic cancer. Last, the 2011 meta-analysis confirmed an elevated relative risk for the development of pancreatic cancer of 5.4, associated with diabetes duration of less than 1 year, with a leveling off of the risk at around 1.5-fold after 5 years. Insulin resistance and compensatory hyperinsulinemia are key pathogenic features of diabetes and thought to be important mediators that link diabetes to pancreatic cancer. Several prospective studies have found that individuals with elevated levels of insulin, proinsulin, and non-fasting C-peptide were found to have a significantly increased risk of pancreatic cancer, which suggests that insulin resistance confers an increased risk of pancreatic cancer. While the risk in patients with diabetes has been well described, this recent cohort study from Korea aimed to determine whether glycemic status and insulin resistance in individuals without diabetes was associated with pancreatic cancer mortality. What they found was that insulin resistance greater than or equal to the 75th percentile and hyperinsulinemia greater than or equal to 75th percentile was significantly associated with an increased risk of pancreatic cancer mortality among individuals without diabetes. I previously mentioned that the relationship between pancreatic cancer and diabetes is bidirectional, and that is because pancreatic cancer can cause diabetes known as type 3C diabetes. Type 3C diabetes is diabetes due to diseases of the exocrine pancreas, which occurs due to destruction or loss of entire islets, which leads to a loss of insulin secretion. Type 3C diabetes is the second most common type of diabetes diagnosed after type 2 diabetes. The most common cause of type 3C diabetes is chronic pancreatitis. However, pancreatic cancer accounts for about 8% of the new cases of type 3C diabetes. The interesting aspect about type 3C diabetes and pancreatic cancer is that the onset precedes the diagnosis of pancreatic cancer somewhere between 6 to 36 months prior to the diagnosis. Another key feature of type 3C diabetes is weight loss, which is different than type 2 diabetes, which is often associated with weight gain. There are many shared characteristics between pancreatic cancer and chronic pancreatitis, including weight loss, diabetes, pain, and even a mass, since chronic pancreatitis can sometimes have a mass-like appearance on imaging. Given these shared characteristics with pancreatic cancer, it is very important to closely watch patients with both a new diagnosis of chronic pancreatitis and diabetes, since there is a strong overlap of symptoms. I wanted to say a few words about screening strategies for both new chronic pancreatitis and new diabetes. First, should we screen patients with chronic pancreatitis for pancreatic cancer? At this time, there is little evidence that supports the use of screening exams for pancreatic cancer in chronic pancreatitis patients. The second question is, should patients with a new diagnosis of diabetes get screened for pancreatic cancer? At this time, again, the answer to that question is no, but more to come hopefully with emerging cohorts from the NCI and NIDDK that I'd like to spend a few minutes discussing. The Consortium for the Study of Chronic Pancreatitis, Diabetes, and Pancreatic Cancer were established by the NIDDK and NCI in September of 2015. The objective of the consortium is to provide a platform for clinical and translational studies to understand the complex relationship between pancreatitis, diabetes, and pancreatic cancer. Another goal is to understand the relationship between diabetes and benign and malignant pancreatic diseases. Recent achievements of this consortium were recently published, and they include recruitment of almost an 1,800-person prospective cohort of adult patients with acute pancreatitis, acute recurrent pancreatitis, chronic pancreatitis, and controls, and almost complete recruitment of an 860 prospective cohort of children with acute relapsing and chronic pancreatitis. These cohorts will be really integral to developing preventative therapies, identifying progression and complications, and identifying biomarkers. There are other cohorts that are developing from this consortium, such as the new onset diabetes cohort, which will follow a large number of patients with new diagnosis of diabetes to understand the natural history. So, in conclusion, both chronic pancreatitis and diabetes are risk factors for the development of pancreatic cancer. The risk of pancreatic cancer declines over time after the diagnosis of chronic pancreatitis, but remains elevated above those without a diagnosis. There is a risk of misdiagnosing a new pancreatic cancer as chronic pancreatitis in the first year after diagnosis of chronic panc. And there is also a greater risk of pancreatic cancer in individuals who have had diabetes for less than 5 years. Insulin resistance is an important risk factor for the development of pancreatic cancer among individuals with and without diabetes. And last, while pancreatic cancer can also cause diabetes known as type 3C diabetes, an important consortium funded by the NIDDK and NCI are working hard to understand the complex relationship between diabetes, pancreatic cancer, and chronic pancreatitis. Thank you so much for your time and attention today. I'd like to just briefly thank my mentors and also CAPER for giving me the opportunity to present tonight. Thank you.